Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing strategies for the open enrollment period and the SEP period in the Medicare world throughout, the remainder of this year, that whopping 2 days left, and through the entire portion of lock-in up until next year's open enrollment period. I think there's some things in here that you might find useful. Planning is important at any stage. It's also very important to implement it, and we'll talk about some ways of doing that as well. Today's presentation is being recorded, and it will be posted on our website at premiersmi.com and on our YouTube channel as well. Everyone who's raised their hand in anticipation of today's presentation will be receiving an email with follow-up for you as well. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the questions section, strangely enough, and we'll make certain that if we can't answer them through the course of the presentation, we normally do, we'll research and make certain that you have the information that you'll need. We're going to start with a little bit of level set because we have a mix of agents on today's call that may or may not be as familiar with Premier Marketing as some others. We are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler working through independent insurance agents such as yourself and their agencies. And we do so through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. We work through a full portfolio of products designed and aimed at our target population, and that includes the base medical coverages for the Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone prescription drug plans, the PDP, Part D programs. But we also have a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits that help add to benefits they may already be receiving or satisfy that need on their own. When you look at the Medicare Advantage portfolio, it has all the national carriers there for you, along with some of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug plans, where those programs are available to you through our organization as well. The vast majority of these come as part of an MA contract anyway. It all depends on certification and how you pursue that business. In the Medicare Supplement arena, it's a healthy portfolio of programs with different marketing support pieces available to help you be successful in this space. We feel it's very important. We have a full spectrum of products to address the needs of folks that are Medicare beneficiaries, regardless of their income, and work to the strengths of each of the programs that are available to them. In those ancillary arenas in each of the categories, the national leaders are there for you. This not only satisfies that need, which is paramount, but it also gives us additional ways to market and create additional revenue streams for ourselves and our agencies. When we look at the Medicare market overall, this is one of the reasons why today's presentation is particularly pertinent, because it's huge and it's getting larger. So you look at the silver tsunami, the aging of the baby boomers, one every 10 seconds, 10,000 plus a day. Well, they're not all in our particular markets, and we're discovering that some of the folks aren't accessing all of their benefits from Medicare when they're first eligible for one reason or another. I'm at the tail end of the baby boomer generation myself, and for me to get full Social Security benefits, I have to work to at least 67. So we see people look at this for working past retirement age or traditional retirement age for one reason or another, and we need to make certain that we're compensating for that shrinkage, in a manner of speaking, of this number. But it's more than made up by this number. 15% of the Medicare population is under the age of 65 and accessing benefits because of disability. And so we need to make certain we have programs that help the entire population. They have some challenges with their health. They have some challenges with their income and assets, and giving them choices, no matter what their base choice is very important. And this is the kind of activity that keeps us working throughout the year and helping people throughout the year because, hey, they can actually decline Part B if they wanted to. Thankfully, most don't. Some will then self-insure for the shortages on the medical care and just pick up the Part D program to help with medication costs. Some will enroll in a standardized, modernized Medigap, Medicare supplement policy, while others will then, bundle it, like it says on American Pickers, where the benefits are through a Part C program, a Medicare Advantage plan that are overseen by different insurance companies. So in each of the choices that they have, we want to make certain that we can help them because, well, it's a pretty even split, or had been, between the base medical, original Medicare, that could be folks that have retirement plans, access through VA, might be Medicare, Medicaid beneficiaries, or people that are self-insuring. But over the course of this pandemic we're enduring, we saw a little bit of change in some of the choices. Aging of the folks into Medicare are skewing some of those numbers to opportunities to cover them as they had at work. They're comfortable with that type of insurance. And so we're seeing some changes as to what some base coverages are when people are first eligible. And in order to help properly explain those, one of the things you'll see as part of the follow-up is a link to the acronyms that are used in our industry, like any industry. I've been doing this for 35 plus years now in the Medicare space. There's always something that pops up and you go, wow, what's that mean? Well, this can help you translate that. And it reminds us to speak to our folks in the language they understand. Using too many acronyms, well, you got a communication problem there. So actually defining what they are, and you'll see I'll do this throughout the course of today's presentation too. It's very helpful in educating the population we serve. A thrust of what we're talking about today, because we're just coming out of the annual election period, some of the standardized programs that are out there, or the enrollment periods, we have an OEP coming up that people can take and make use of, but we can't really talk about it. Is that a problem? Well, sometimes, yes. We have to be careful how we approach that, but it gives us the opportunity to speak to the get out of jail free cards, so to speak, those special election periods that allow people to change coverages throughout the year. 3 of them, John? Well, no, there's a ton of them. And you'll find as we go through these, if we went through these individually, about the majority of people on Medicare qualify for a special election period. It's then our obligation to get information to see if it would behoove them to change their coverage throughout the year. And some of these are, well, hey, it's part of nature. You're aging into Medicare. You're moving from one service area to another. There are a ton of the more popular ones that are available, or we see more frequently, that are important for us to make certain that we are serving the population that we need to in this circumstance. Pardon me, I've got some, didn't shut off my phone properly there. And there are, of course, the additional special election periods that roll into play based on weather and other special circumstances. You'll see as part of the follow-up to today's presentation, the most recent of these that we have will come out to you too. We say all that and we talk about OEP planning and planning into lock-in. Why is that extra important? Because of folks beyond those natural courses of aging into Medicare and other things. Well, Kaiser Family Foundation tells us that the majority of people don't examine their plans during open enrollment period, the AEP period, that they really need to. Because, we've been in this business for a little while. You see some of the changes that come about because of medications and provider changes and a number of things in the Medicare Advantage space. Even if you work med sups and are dealing with some of the standalone Part Ds, well, that's where you see a lot of the changes and some of the things that can really hit someone's pocketbook. So it's especially important that we look for the folks that are, based on our marketing program, our target audience. And that might include some of this particularly vulnerable people based on one reason or another as to why they didn't examine their coverages. So it's a huge market overall and a huge one for us to address, because they need our help throughout the year. And they're not using some of the data that's out there, the programs that are out there made available by the government and Medicare. The standalone details that are out there, we're all well aware of how the plan finder on Medicare.gov has had some challenges in the last couple of years after they changed vendors on it. And they're not reading through their Medicare and U book. They're not looking at some of the apps that are out there. They're not even examining some of the really cool things the government puts out there to help them understand their different coverages. And it's important for us then to be able to deliver that information in a manner in which they'll actually read it and use it. So the whole sitting across the kitchen table, even during times of pandemic, as an essential part of an essential industry, we can still do that as long as it's safe for everyone involved. And sometimes then having the tools to follow up electronically is a big deal. And working with carriers that can offer us that capability, or marketing organizations that have programs that can help you with that, is very important, because the folks are being trained to accept things electronically where they may not have in the past. You think about it, for over a year, no one actually saw their doctor unless it was an ER or a hospital stay. A lot of those visits were remote. They were virtual in nature. And it's taught the population to accept that as part of a delivery of information. So it wasn't just the docs and specialists. Hospitals did prep work that way. Dentist office did prep work that way. Faith-based organizations had been and are still delivering their services over the internet or virtually as well. So we've got folks that are becoming much more comfortable with it. So it brings us to the crux of our situation as to how do we take all these factors into account, put a plan in play, and work through what we need to work through to be successful for ourselves, our agencies, our families, all the obligations we have. And that includes the obligations to our clients that we may not have been able to visit with during the annual election period. And then, of course, the prospects that we're looking to add to our book of business and make them our clients instead of just a policy holder. The first step, well, it's a roadmap. What's our goals? How do we determine where we are, what we want to do, and how do we work the mix, in a manner of speaking? And a lot of it is motivated a couple of different ways, intrinsic and extrinsic types of rewards. Obviously, we're not social workers. We need to make money doing what we do without interfering with the best interest of our prospects and clients. And this can bring about not only a very successful way of earning a living, but also some very unique internal satisfaction factors that come into play. You're helping people. So we take those goals for however we're looking to use those underlying factors as how we approach the business, and lay it out into, here's where I want to be by mid-year. Here's where I want to be by next AEP, year, 3-year, 5-year. There are some really cool tools that are available to help you understand how those commissions can multiply and how they can feed in a renewal process as well. And we've got to make the goals a bit of a stretch, but something realistic, and take into account those monetary factors that can come into play as to, well, here's my mix and here's what I'm going to do. So we plan for what we want to do. And in order to do so, we need to know where we're going. So like the C.L. Lewis book, Alice in Wonderland, if you know where you're going, well, then you can chart a path for it. If you don't, well, it doesn't matter what direction you go. So our goal being of getting in front of buyers, be they be clients or prospects, it's important for us to understand where we're coming from. What kind of insurance agent or financial planner or whatever title you put upon yourself, what are you offering the public? And then where are you looking to market that? One of the things the pandemic has done is it's really increased our propinquity. We can go a number of different places outside of a singular physical target market and do some things virtually. You see a lot of agents that have adapted in that fashion and are doing well with it, and the tools are there to do so. But you can't underestimate the value of being a subject matter expert, a recognized subject matter expert in your area of expertise in a particular market. And that's some of the things that we'll use to help plan moving forward. And some of the things we do will have additional regulations. We work in the Medicare space. For those of us that are active in MA and PDP, we realize that there are certain marketing restrictions we have in that area that we don't in MedSup. So how can we work those across the board? And then, of course, different regulations for some of the ancillary products that we discuss. But you look at what Medicare doesn't cover then, long and short-term care products, different requirements there, different ways to reach out to the public, life insurance and final expense. The whole gambit has us looking at how can we use these different areas and the regulations we're subject to or not subject to in order to fuel the engine that we're looking to use to drive our business. So regulations aren't necessarily a bad thing. Those annual certifications, yeah, they can be time consuming. They can be kind of a pain in the tuchus, but it keeps us abreast of what's going on and makes us realize that in different markets, hey, things have changed. So let's use these as a way of reaching out to the public. For those of you that have set up appointments for MA and PDP, you did the scope of appointment. It's a cheat sheet for you. It's got other product on it, and you can store that. And particularly in some of the tools that our organization offers, it gives you then an opportunity to have a built-in target market. Because, hey, if you're going to sit around waiting for the phone to ring, you better have some really good marketing programs to do that, because otherwise you got to be Pepe Le Pew-ish, pursue Penelope, and ask to be kissed. That sort of thing. We need to be active in that area. So as we look at the numbers that we want to approach, that destination that we visited about with Alice in Wonderland, we can do some basic math. I'm pulling an old commission number here for renewals on MA, so I'm being very conservative. And for folks that want to hit a six-figure income off of that, well, they're going to have to do about 500 apps, because remember, we get into part of the period of selling those programs, our income or a commission on it becomes prorated. So we want to look at how do we break down that number? What do we need in the smaller bites? The old expression, eating the elephant, how do you do that? One bite at a time. So what do we need per week? What do we need per day? And then how do we go about reaching that number of sales based on marketing efforts? Because even though some of you are very good closers, I don't imagine anybody has 100% close on everybody they talk to. If they do, I'm a little worried, because hey, they may have some special circumstance we can't cover or whatever. But this then translates into, how do we generate those leads? Do we do some of the tried and true mailers that we've done in the past? We've seen, returns on those drop a bit, but they're still dependable. Do we work with centers of influence in our community? Are we accessing all the referrals that we can in order to get multiple sales out of a single lead using social media? Where else do we go to find the people to talk to? Our base activity to drive some of this other information. That gives us then the opportunity to also examine what we're going to offer, because you can use different programs for different products and cross-sell off of that. We did a series, or started a series here, on folks that are financial planners that hadn't done a lot of Medicare in the past. And they're looking for folks that have disposable income for other products as well, but growing an income stream in that fashion. So we're seeing a number of folks that are becoming involved in the Medicare space that hadn't been in the past. And how do we go about targeting a population that's affecting the Medicare space, but can also grow our current business? And we want to make certain that all of our activity is productive. We're getting a maximum return on that investment of that activity. And so that may affect how we're prospecting as well. So when we come up with that number of the dollars that we want, and we're looking at our portfolio of products, where do we see those commission dollars coming from? Are we more active in the Medicare Advantage space? Half of our business comes there. a portion coming from Medicare supplements, some from life insurance, be it final expense or traditional life, and then those ancillary products. These are percentages I just pulled out of the thin air because they vary according to the individual. And you may see some folks where this number is larger and this one smaller, or vice versa, and this one be much larger because ancillary benefits are, well, gee, discussed to death on commercials during AEP. Are you getting everything you're entitled to? It's free. All that lovely stuff that we saw back to back to back during the open election period on commercials from retired athletes or entertainers or boxers or whatever it happens to be. That created a whole bunch of questions for the rest of us, which is not necessarily a bad thing because it stimulates that conversation. But we had the challenge of trying to fix some things sometimes where they may have been put into an inappropriate plan. But this then gives us an idea on our regular track as to where those dollars are coming from to hit a differing goal that we have in place based on our own personal experience. We take and we crack those down per month. As I mentioned before, eating that elephant at a smaller or a little larger bite than a daily bite, but that gives us what we need per week to do things. There are agents out there that have a system set up that may work for them, may not for others, that they do a lot of virtual applications. So you have more time to reach out to people, having some great success in selling much larger numbers than this. We have to also look at those then and see what's the persistency on some of that business, because it's not just what you sell, it's what you keep. We're in this for renewals as well, and that may very well affect the offerings that we have based on our expertise and the way that we pursue that business and consummate that business as well. One of the things to take into account as we go through the year as well is, are we getting better? Is all this activity helping us, or are we forgetting to do some of the base blocking and tackling that we need to do to be successful in our area? So you can do the same number of leads, you can do the same number of appointments at the first of the year with a newer product. Toward the middle of the year, and as you roll into next year's open enrollment period, you've probably gotten a little better at it. Your sales techniques are possibly improved. Your knowledge of the programs have improved. It's just practice in many of the circumstances. And that can grow our income without affecting some of the underlying data. We just got better. And that can make a big difference for us as well. And part of that, in order to do so, we need to plan properly. So do we have the tools that can help keep you on track? Daily activity trackers. How many dials did you do? How many appointments did you have? Do you look at things on an overall weekly basis? Are you setting up your calendar with slots to help you? Here's what I'm going to do at this time, including training and some of the other things that you need in order to increase your overall productivity. And how are you using systems to help you stay abreast of your current situation? When we all used the old planners that we did manually, writing in on a calendar, and some folks still do, we had different slots as to, here's my standard Monday where I have appointments at this time, and this time. I'm looking at different times of the month where that activity may be higher than it was at others. And then how do I work in some of the training and some of the local area marketing pieces, be they live or virtual, as part of my calendar? You're working with different networking groups. I don't know where that ESPN came in there from, but hey, anyway. So you got different things where you can set up a track and it's the old, oh, it's Tuesday, this must be Philadelphia. Sorry, old movie reference. But it gives you an idea as to how you slot things and how you keep yourself in order. You also have people you need to account to. First and foremost, if you're working in a captive capacity, you got a manager or boss you need to talk to. If you're working in an agency, you have that as well. Sometimes that boss is a partner that you have in your own agency, or yourself, or your significant other. And how do you have your agency set up to plan not only for now as you're growing it, but to protect yourself legally and to ease transition should you choose to sell your agency in the future or pass it on to one of your children or your partner. Base accountability, however, comes from ourselves. The in it to win it, the whole got the round to it's all set up. And based on some of the things that we do as to how we want to perform, both monetarily and the way we do business, can make a big difference there. But holding yourself accountable is the whole, okay, we got a plan, we got the product, you got a nice car. Are you putting gas in it and actually driving it? How do we hold ourselves accountable? And then once again, how do you come into fitting in all the things that you need to do in order to be successful with your planning? So one of the first things is we need to know what we're talking about. There are a ton of different programs out there that can really help educate you on different programs. Carriers at this point in time, you got your base certifications done if you've been active. They have other training programs that can help you throughout the year. Boy, we've seen an improvement over the last few years on some of the carrier trainings, with some carriers particularly, where they're looking at different approaches as well. And they have marketing material put in play where you can plug and play with them and make it work. Plus, there are programs that we offer on how to market, information about the different carriers, different segments of the carriers, particularly now since many of the special election periods in the Medicare space are income based. Are you comfortable with how to get people extra help for the cost of their medications, the low income subsidy? For folks that are at lower income levels, because LIS will go up to 150% of federal poverty level, the MSPs, the Medicare savings plans that can help with the base medical cost in many cases, goes up to 135% of federal poverty level. Are you comfortable with them? I'm not saying you have them all memorized. That sort of thing is that, boy, good luck on some of those sometimes. But if you do it enough, you'll know some of the numbers that can help you, and then you can investigate, which is what you need to do anyway. You work in some of the Medicare supplement space. How are you determining what your portfolio is? How are you quoting that? Are you comfortable with the Medicare.gov plan finder? And are you working your referrals? It's the whole thing of, well, I'm a bit of a history buff, so I have to go back to Seneca, the great Roman philosopher who's really dug into his past and one of his predecessors and said, hey, it's an inexcusable thing for someone to say, I did not think that would happen. As we gain experience in the area, we know different things are unforeseen, but they may well happen. No one really saw us all being shut down for a period of time until we adjusted by the pandemic. Who saw that coming? I'm going to confess I missed it. But it really did push some of the changes that have been asked of us over the last few years in the virtual arena. So it wasn't necessarily an entirely bad thing. We needed to have our base information down, and then how do we adjust? So those base certifications, if you did AHIP, you can add additional Medicare Advantage and prescription drug carriers a little easier than if you hadn't in the past. So that's available for folks. And we need to know what the carriers expect in their individual certifications, because some of them will accept AHIP, majority do. What does that take care of during the certifications? If I add something that I ran across during AEP in this arena and didn't contract with them, but I'm seeing it, boy, there's a lot of support from that carrier in my market. What do they require with their certifications? We have that on our website. And then, of course, Medicare does a number of really nice trainings as well. And this is where we can get some of the presentations for our virtual or live seminar webinars. And we have a full library of those where we can help you in that area. Once again, making certain that we speak the language that is theirs and how we translate that for our population to help them understand the offerings that they have. And CMS has a neat thing that a lot of folks don't really take advantage of or may not be aware of, where they have marketing material on a separate site that you can go in and access, much of it free of charge. You can order up to 50 calendars a month without cost through this site. So there's some neat things that you can use to stretch your marketing budget, not only from the carrier support, but from the government as well, and from your marketing organizations such as ours. Carrier support, I got to tell you, it's an underutilized area for many agents, but the carriers have really improved their agent toolkits. This is a representation of some of the information brought up to us by United Healthcare, available without cost with certain ordering restrictions. We can help in that area because our ordering amounts may be a tad larger than some. But these are materials that are available, much of it branded, but in multiple languages that can help us. Their toolkit also has great detail, many options available for target markets. I mentioned the financial planners. They got some neat pieces there to help you approach people, but there's also material available on a generic basis. And so when that comes about, it really helps us influence our decision as to what carriers we are going to offer as well. If you're out there as Don Quixote tilting at windmills all on your own, because Pancho, he got tired, he went home and he's eating or drinking mead with his wife, whatever. How are my carrier partners going to help me too? So connecting with the agency managers in those different markets can be a big difference for us as to how successful we can be. Then, of course, your marketing team with whom you contract or contract through, what tools are they offering? I cannot preach the value of Medicare Center enough as to what comes with this program available without cost to our agents and the agents of our Integrity Platform partners. All in one single log on for 3 different quoting tools: Medicare app, Medicare Link, CSG, white labeled for programs powered by Connecture, Sunfire, and of course CSG, all in a singular tool. The information is available to you through a CRM that only you have access to. It enables you to take care of those compliance features of getting that scope of appointment by multiple means: text, email, even a voice component with one of the programs, and have resources in there that include sales scripts and other pieces of information that can make us very, very successful. And what does it cost you as an agent contracting with us? Zero. To quote J.J. Walker, George Foreman, William Shatner, any quarterback that's been retired for 20 years, it's free. That's the nice part of this. There's no additional cost to you. And it has those different ways of utilizing technology to get in front of people compliantly and to store that information for that 10-year period that the government asks of us, if we sell them or not. One of the pieces that's really helpful is the quoting tool if you're active in the Medicare supplement space, particularly through CSG, because it gives us the opportunity to have not only information to help us cross-sell across the board, but you can run complimentary Medicare supplement reviews, see how this program works for you, and what type of market influence there is in it. You have heat maps. We're coming out with a fresh presentation on that you'll be seeing some detail on as to, well, I'm active in med subs. I'm seeing some things happening in this area. I can determine what works based on premium and some of the components there with underwriting, but who's selling what? And you'll see some of that information made available. You can pull off of this site yourself and figure out, gee, I need to make certain that not only this carrier is very aggressive in their pricing, but they're being offered a lot. So I need to be either able to offer that or be aware of it so I can sell with it or against it. And how do you do that? Well, I'm going to do something real quick here. Pardon me just a moment. As you go into the Medicare Center program, you don't need to bypass. You'll have already signed into this. But this gives you then the opportunity to go in and run quotes, do some different things. Really simple. It walks you through a system. It speaks to you about the disclaimers of what policies can be offered to what individual based on when they were effective in Medicare. So that gives us an idea. We can then go into a space where we are then active and punch in some detail. You can see I quote a lot in North Texas, or gee, there's a Nebraska zip code in there. Thank you, my sister. But let's look at, well, let's go to Florida. Let's look at a 67-year-old because it's a different offering. They probably have Medicare already, and we're looking at Plan F because you can still offer it to the people that qualified for it earlier. Or we're going to have a household discount, or is the person single? How does it work? Well, gee, I've just entered in the information I need to have in play because here that F isn't there. So it gives us the detail as to what we need to do. Well, I got an invalid zip is what I got because somebody didn't do that thing properly. Let's do this. Pull a proper zip. Let it think about things for a moment. It's loading, it's thinking. In the background, you're hearing the theme to Jeopardy. Just kidding. So, boy, it's taking a little longer. There you go. You got a couple of different counties there in Sarasota. Let's select them all. Let's get a quote. Gonna think a little bit here again. And it'll tell us based on income what's available, or pricing, I should say, what's available and what's most active. And it'll speak to the fact that this program has e-apps for the med subs as well. Because even though we're accustomed to doing a number of things face to face, some folks don't want that. They want some things handled electronically. And we're finding an increasing number of folks that are shopping before they talk to us. Some of them will buy direct, not as many as you think. They still want to deal with an agent. And these programs can help you with a microsite that you can put in your communications and everything else as well. So it gives you then the opportunity to look at what's hot in my zip. Are there policy fees? What are some of the details that are there? Can I look at, well, gee, how do these go up? Or what's the price increases that we see? And by using some of the market analytics that are available here, it'll tell us where some of that is. What's the space of it? How much money do they have on the books? Because sometimes that'll tell us how then they can absorb some of the claims that are coming into play. And are we going to have to deal with major price increases after 6 months, after a year? How is this going to work? Because keeping in mind, you still want those renewals. And these programs, some of them have gone to lifetime commissions, some of them 6 to 7 year period. And you know what can happen with pricing and aging and everything else that comes into play. Plus, plan type may be important to an individual at one point in time in their life and not as important on another. So this gives us a detail that we need to see, okay, wow, gee, single digit increases throughout the years, a 2.6 increase. Oh, it's the big boy. They got a ton of money on the books. They can absorb a hit, so to speak. So we're going to see some of that come available. And this is some of the detail that we work with folks to make certain that they have. So Chris, this is some of the stuff that's coming at you and some of the things that are available. That's strange. Yeah. Strange how I picked that zip code, isn't it, Chris? So this is some of the detail that's going to come to you, be made available to you. And I got to tell you, if I can run this program, a whole bunch of folk can, because I am not the most technically adept person in the world sometimes. A great way to help us across the board realize that these tools can be really, really helpful for us. It also gives us an indication of, if we're working in the Medicare Advantage space, who owns that market or who has a chunk in it, or am I in an area that, man, it's kind of a free-for-all. I need to make certain I am cognizant of the fact that it goes beyond price and market share, because there are some carriers that do what, you know, a friend of mine in the industry used to call toilet seat pricing. One year the lid's up, one year the lid's down, and sometimes it can be kind of crappy. We want to make certain that we look at not just the market share, but we look at the benefits as they change year over year. What are the providers like? Because it is a network driven program. How can we deal with the multitude of programs that are out there, offer them, or compete against them? Because we don't want all of our eggs in one basket. We realize that there's no one ticket, no one shoe that fits everybody. And we need to be prepared to pivot, because we might start out virtually, have to consummate the relationship, so to speak, in person, or the other way around. We've given them the information, we sent them some things virtually, they did some investigation, or hey, they want the tactile stuff. I want to use a sales kit, I want to look at it. And some people are that way. But we can conduct some of that piece, and if they don't close in one close meeting, can we pivot to an electronic means to follow up on that application? We can. It's just a question of being flexible enough to do that. And so we're going to look at integrating in a number of different marketing programs to make what we do part of a comprehensive plan, and look at the different areas that can help us reach the people we need to reach. Some of this may stretch our comfort levels. Some of it may stretch our skill set. But utilizing the different programs doesn't mean you got to everything all at once. Piecemeal it in together. That may affect some of our income plans initially, or based on the success of one area or another, how helpful some of this can be. But you got a number of different resources to access. The old tried and true cold calls, well, a little harder to do now that Big Brother announces who we are all the time. And some folks don't pick up off of the toll-free number or whatever else. Or if you do it a lot and you're marked as a telemarketer, that can hurt us. But you can't do that for every type of insurance. You can't cold call for Medicare Advantage and PDP programs, but you can for final expense, some of the life insurance, long-term care, some of those different programs that are a little more less pervasive, I'm trying to say, on it. But it also gives us then the opportunity to realize that, hey, there are programs that are demand products that we can use to kind of fill our pipeline across the board. A lot of agents we're seeing now are working with different dental programs because folks are accustomed to having some of that assistance at work. And then when they go on Medicare, they find out, geez, different world. Working with those people starting at like 63, 64, because some of those programs have price increases at 65. You can lock them in earlier. Great way to fill your sales funnel with your own T65 list. Some folks then will look at other ways of working in the community. I know the Walmart program took a pretty major price increase this past fall, but we saw a lot of agents be really successful in that space, but they worked it. It wasn't one of those where you went and sat and wanted people to come up and say, here, kiss me, will you? They seem to be kind of fixating on that, but they worked the area around the store. They worked the management in that store. And it helped them then because they went into the community and looked at the different faith-based venues that are available to help people become aware of the fact that you could do reviews in that retail setting or set up separate events in that location as well. It also gives us the opportunity to look at some of the folks that deliver upon the care that we're looking to help people cover. So doctors, specialists, hospitals, dentists, other folks that bill Medicare or a Medicare program for their services, durable medical equipment companies, home health care agencies. These centers of influence and others in the community can be very, very valuable for us as we establish ourselves as that subject matter expert in our chosen market. It can be live or it can be virtual. Just keep in mind, a lot of these locations have dealt with the same challenges we have as to how do we reach our target market. Churches. Boy, all of a sudden, they've got some systems that you can help utilize and help bring additional return to them by using them through presentations to the congregation virtually. So some really cool things that can come into play that can help you. And then, of course, if you've been active with different carriers in the Medicare space, they may well have programs throughout the year to help you too. There are social media programs, referral follow-up. I've got a neat link that we'll send to you that can help you take one lead to 10 simply by asking some simple questions at different points in time without feeling like a used car salesman. No offense to the used car salesman. I usually use the Herb Tarlick with WKRP and the whole plaid jacket, the old inference of opening the coat and say, hey, you want to buy a watch? Some folks, guys, I'm showing my age there. Some folks don't recognize who that is. But you have that available to you. And of course, the tried and true direct mail programs. Ma Bell, you're comfortable smiling and dialing? Pick the product, pick the area, and don't be afraid of it. And remember, it works. When people pick up, you got 30 seconds to hook, thereabouts. What are you using as that hook? Are you dialing for dollars or are you dialing for dentist? How can you make that call effective? We have custom contact lists that we can provide for you, minimal charge or no charge at all, that are butted up against the do not call list. And remember, any list is not 100% active. People move, people die without our permission, all these lovable things, but it's available for folks who want to work that. Community-based programs, we've got recordings on these as well as how you can be effective throughout the year with them. Retail marketing, yeah, it happens a lot with a lot of different sources through AEP, but many of these are continuing year round. You don't work the same number of hours. The location is very important because we want to make certain that whoever we work with, not all the business is going through drive-through, and if it is, how can we reach that population? We want to maximize our return on the investment, not only of dollars, but of our time. Provider marketing, particularly for folks that are comfortable with perhaps disability income, full life insurance, you're looking not just at the patient base, you're looking at the provider too. A lot of times when you get into doctors, they may not have looked at their DI program from when they got out of medical school if they took it then. So we've got kind of a two-pronged approach when we go into provider marketing, and how that DI program will vary according from the doctors and specialists to dentists, a little different angle. We've got programs that can help you there too. Looking beyond just the obvious between the doctors. And the approach can be modified because not every doc's on a network. How can you help physicians that choose to not participate in some of the insurance programs protect their patient base as well? So we go through that in some of those specialized trainings in that area. How do you find them? Well, for Christians, you can go through Church Angel, and it'll give you detail on where the churches are in your zip code, in whatever. So this is some of the detail that you can pull or be made available to you, Chris, as to how can I reach out to this population? Because, dependent upon the size of the church, they may not have full-time people. So cruising and door knocking here could be helpful, or it could be a real grind on time. And we got to watch how we use our most valuable asset, that time. You have that in a number of faiths. So when we go through and speak to our faith-based marketing initiatives, we speak to different religions and how you can find mosques or synagogues or other areas of worship and approach in much the same manner. Carriers, well, this is a symbiotic relationship. A lot of it, as you're newly contracted, they may well give you some help in this area too, but we see this a lot with established agents who are working to accommodate business to a carrier that's popular in their area. They've done business with them. They're going to help you along the way in many circumstances. And some of it may be not an exactly fresh lead. Back when I worked for one of the carriers, we used to call some of this stuff Lazarus leads. You're resurrecting it. But a lot of that resurrection may be because somebody just couldn't get a hold of somebody. So it can be very helpful to you. When you look at social media, boy, there's a gambit of stuff out there. A lot of folks are really active in the um, different platforms that are available. Some make use of the lead generating companies that are out there that specialize in that area. You can do it yourself, make it a DIY project, or you can use a company that's doing it for you. And then, of course, referrals, not only in your current situation of selling on an ongoing basis, but working your book of business and having this as kind of a one-liner at the end, the old Columbo close. Well, I made myself again, but you get to the door, you turn around. No, just one more question. How do you handle dental expenses? Or who's your dental coverage with? Or um, what company do you use for cancer protection? You know, you have a ton of different pieces there. That's that one off that might well be that hot spot for the person that you're speaking to. And one of the things you'll see is a link to this as to how you can ask that question without coming off salesy. Direct mail, I'm a big Monty Python fan, and one of the things that you see in one of their more comic routines is the collection of people during a plague. Gee, that's funny, John, but they're dragging a guy out, and he says, "I'm not dead yet." That's kind of like what you see with direct mail. It can be dead if you don't work it correctly, like anything, and not consistently. So you deal with direct mail, you might get a pop off of a single mail drop, but where you see it is much like in an exercise program. You do it consistently. That's where you're seeing the results build off your past activity and can be a big difference for you. We use certain carriers and vendors for that. And we'll talk about that in a little bit. But it gives you then the opportunity to cross sell based on some of your mail activity, your mail in for dental programs. Can you make any money on dental programs? I tell you what, you go into a house and you do a husband and wife with a decent dental program, you make in the same area as you do on an MA plan in many markets. So it can be a big difference for you. And we'll see that as we sell and have more product in the household, it drives up our retention, our persistency as well. So when we look at some of the things that you get on these different areas from Premier Marketing, we talked about having a proper product in place. This can really help. Set up an agent profile, insurance pay, store your errors and admission, answer the questions, and then pick companies electronically, and it'll autofill for you. Back in the days when I worked for a major carrier and pre a lot of electronic stuff that was out there, over 70% of our applications pended because the company couldn't read our handwriting. You have some of that same things going on in contracting as well. Plus, it's easier. You can't submit it unless it's complete. So it really helps us there. And it's a nice storage for our information. Errors and admissions coverage, we discount that for qualified agents. What's a qualified agent, John? You got a contract with us. But this is a program you own and can satisfy then this requirement with insurance companies, no matter who you're contracting through. And that's important because there are folks out there that will add you to a blanket policy for one program or another. Helps with that, but gee, you got to worry about all the other. Have a plan in play that can help you protect yourself. Your own a malpractice program that you own at a reasonable rate. We speak to also the different continuing education programs that are out there to help keep your license in play. This is very important, obviously, but through our relationship with WebCE, we have bundled CE programs available at very reasonable rates. And we also offer a program for you to add to your own benefit package through modified guarantee issued disability income plans for you, in which you're paid a commission on writing yourself. And what's as important as protecting our own ability to generate income? Well, this can be very helpful for you too. I mentioned that today's presentation is being recorded. We've recorded past presentations available on our website. They're available on our YouTube channel. So as we go through these different categories and you see them and you want information now as to provider marketing or working faith-based programs, we've got those scheduled in the near future to go through them again, but you can look at past recorded presentations at your leisure and gather that information and make that part of your marketing program. Once again, accessing information through Medicare Center and that features that it makes available to you, it also helps us manage and track our clients. So it can be the basis of a year-round activity by gathering the data out of this system and working it for you. And it gives that great cross-sell too. If you've ever been into a house as a agent offering Medicare Advantage programs, certain markets are dominated by one carrier or another, and you're not going to change them. They're happy. They just want reassurance that nothing's really changed. Well, they have an MA program. It's got those hospital copays. You have a system here that can help you sell hospital indemnity plans. Fill in that little gap, and it adds to your client base, adds to your income stream, and most importantly, adds to the protection of your prospects and clients. And keep in mind that cross-selling then, that's where we drive our persistency of products across the board. Keep in mind, these programs don't have to be from the same carrier. They just have to be from the same agent, and that's you. And it can drive your salary, so to speak, year over year by growing your renewals and keeping them in play. We also want to make certain that you realize that there's additional compensation available for you in certain areas. Some of the carriers have additional incentives. We see this a lot in the Medicare supplement space and in some of the ancillary programs, and that drives additional income for you. It may also help with carrier trips based on the company you're working with, and it might help you qualify for some of our additional incentive programs as well. Those lead programs, again, contact list, community-based programs, helping set you up with carriers and making certain that you're working with the folks that actually control those programs are very important. How we can drive internet and direct mail support. We also have a really cool T65 locator we'll talk about in a second. And then, of course, that referral program. Our direct mail programs are based on production, drives down the cost so you can do some things consistently, and it's through vetted partners where we're then making certain that things are handled compliantly, but we also want to make certain that each of these folks have systems in place that can help you be effective there as well. And you can qualify for it twice, once for health programs and once for final expense if you're active in different areas. We also have a program in play that, well, gee, I just need to fill in some openings in my calendar, or I can't wait for that 2 to 3 week period of sending out my own campaign, or gee, that's a little more than my budget can do here. Well, these are never distributed mail, direct mail responses. So you're buying responses here. They may not be as hot as something that you can contact the same day, but they're folks that have reached out for information. It gives you the opportunity with permission to call on those folks and work a system that you need it as you need it. Great way of doing it. The internet lead programs that we have are based on Facebook. That's the most commonly accessed social platform for our target market, and we have them in play for both final expense and Medicare. That T65 program is available without cost for our contracted agents, and it gives you basically locations, physical locations, that if you're a door knocker and you're out talking to people about MedSup programs, a great way to do it. It gives you then an idea too as to where folks are if you work final expense. You got to watch how you cross over in some of the compliance pieces there with both those programs and MA and PDP, but it gives you the opportunity to actually see where these people live. And a lot of final expense agents are really good about programs on how to door knock. This can give you that detail in your target market. Once again, that referral program, when you get the follow-up to this, make certain that you take just a few minutes to look at that presentation, because it'll help you grow one lead into multiples simply by timing your questions and doing so in a fashion that's basically non-confrontational, or in certain aspects is confrontational, because you want to create that urgency in a person without coming across as a total jerk. We do all this simply because we want your business. We want you to be an agent active with us, and we want to do so because it benefits us all. We don't make money if you don't make money. It's all overrides. It doesn't affect your commission level. It does, however, give us an opportunity to work together, combine our strengths, and make certain that you are comfortable enough to refer other agents to us. We'd like to see that as well. So through some of the things that we discussed today, I urge you to go back and look at some of the different categories. Is this pertinent to what I do? How can I make this part of my personal marketing plan? And then put it in play. That's the big thing, you know. You got a wall hanger shotgun, you don't go hunting pheasant with it. It's not going to do anything except, okay, I'll look up, it looks nice. Worthless on a wall. Are you using what's available to you? So as John Wayne said in the movie The Cowboy, slap a piece of bacon in that biscuit, saddle up, let's ride, we're burning daylight. You can do this at any point in time. You can kick it in now. You can kick it in before you actively start pursuing some of the business in a couple days if you're looking for the new year or you're taking the holiday off, that sort of thing. You can time it and it can come into play really quickly. So one of the things that you can find when you want to speak to someone about some of these programs, use our toll-free number, 1-800-365-8208. If you're working with a marketer in the different spaces of the products that we have already, they're going to help you. If you're not, we can set you up with a subject matter expert to help you in that area too. You can also reach us through our website at premiersmi.com and follow up or basically respond to the email that you'll get about this program. So we're at the top of the hour, a little past. I want to thank you for spending your most valuable asset with us in this last hour of your time. I thank you, sincerely do. For those of you that have done business with us in the past, I thank you for that business. For those of you that are considering doing business with us in the future, I thank you for that opportunity. And until we're able to speak again, I wish you good selling. Thanks so very much. We'll talk to you very soon.